Now, like many African nations, Kenya continues to struggle with inadequate mental health services, outdated policies, and a shortage of trained professionals, gaps that have left thousands without access to timely care. In a bid to curb these challenges, the Kenya Medical Training College, KMTC, has hosted a two-day training program aimed at building mental health leadership and advocacy capacity across Africa. The training, delivered in partnership with the Africa Center for Disease Control and Prevention, that is Africa CDC, brought together delegates from 13 African countries who are equipped mental health leaders to drive policy, reform outdated laws, and ensure mental health is integrated into health systems at all levels.
If you look at the continent, 50% of the countries are still having laws that are not consistent with human rights, with global standards, and cannot really help countries to address the mental health challenges. How can we train leaders that will help us to interact with other sectors? Because we all know that the social determinant of mental health lies outside health sectors. It has to do with education, it has to do with justice, it has to do with many other sectors.
Mental health for a long time has been dealt with like a small issue, a separate issue, but mental health is health, it's part of health. And as the Africa CDC mandated to secure public health on the continent, we need to look at issues of mental health. A lot of lessons were learned from the COVID-19 outbreak that mental health is an important aspect.
We have programs, diploma programs in mental health, especially the mental health in nursing and psychiatry. We have higher diploma programs whereby we train nurses and clinical officers in mental health and psychiatry. That means they are able to meet the specialist need for mental health treatment.
Our Cooperatives Cabinet Secretary Wycliffe Oparanya has asked Western Kenya residents